I'm Sanjay Iyer. I'm a movement disorders neurologist. I mostly take care of people with Parkinson's. Exercise has been really important to the world of Parkinson's, but also to the world of neurodegenerative disease in general. We look at the impact of exercise on how we move. We can look at the impact of exercise in terms of how we think. How we remember, and we can look at the impact of exercise on things like our mood and our emotions. And there's a lot of data to show that indeed it does improve and impact all of those domains. We have our all-star cast here to help fill in some of the blanks in terms of where that data comes from and what it means and how it translates to individual patients. And we'll talk a lot about just different types of exercise. Different options on where you can find those types of activities. Importantly, how do you do it safely? Because, we certainly don't want to make things worse. We're also going to touch a lot on cognitive therapies and even strategies and apps and different gadgets and tricks that help people attack some of these problems. But I think this just shows that we have a very similar philosophy in how we treat our patients in that, there's the concept of passive treatment. Here's your prescription, go home, take your pills, and I'll see you in 6 months. Or, how do you actively treat people, or how do patients learn to actively treat themselves? And that's where empowerment and exercise comes from. So to start with, Kathy, tell us, why exercise? Why does it work? Tell us about some of the data that you found.
Sure. So exercise plays a crucial role in the management of Parkinson's, but also dementia and any neurologic condition. And Melanie has some links in the chat box for some of the articles that I pulled this data from. So there's a ton of research out there about how to exercise and what type of exercise is beneficial. And all these research articles, of course, promote exercise as the answer, but then the question is, well, what does it do, and then how do we do it? So what's the best exercise for each condition? But exercise, it improves, with Parkinson's, it improves motor symptoms. So it improves the bradykinesia that you have, it enhances balance, it enhances gait. It has neuroprotective effects, which I think is super interesting about exercise, is that it protects your brain, and it can prevent the declines that we see with Parkinson's. It also can improve our body's ability to use the dopamine that we already have. So the medication that's prescribed helps with the dopamine, but then when you exercise, your brain uses the dopamine even better. So all these. And there's so many articles. I kind of just picked 4 good ones that have different information in there. But I will say that exercise, I think the biggest impact is that exercise gives you a way to empower yourself with your disease. So to take charge, so to speak, given our topic. So it just makes you feel like you're doing something that is going to give you a positive result. Exercise is also shown to help those who have dementia. So it could be separate diagnosis of dementia, or the dementia that may come along with having Parkinson's as well. It's been shown to improve cognitive function and slow cognitive decline. Jessica will speak a little bit more on that. But it also impacts some of the non-motor symptoms that come with Parkinson's as well: anxiety, depression, constipation, mood stuff. It improves all of those. But the question is, what type of exercise is important? And so in some of those articles, you'll see that for Parkinson's, they strongly recommend high intensity exercise, that is the best, that it can not only slow down the progression, but it could possibly reverse some of the neurodegeneration that happens in Parkinson's. To me, that's amazing and exciting to think that you can actually kind of control the diagnosis. High intensity exercise is 80 to 85% of your age appropriate max heart rate. And the recommendation would be for high intensity that it's at least 3 times a week. For cognitive impairment, dementia, the recommendation is more of a moderate level exercise for 30 minutes, 5 days a week. So it's a little bit of a different recommendation for each of the diagnoses. And I want to point out that these are just minimal requirements. So the more you do, the better it's going to be. These are minimal requirements. And moderate exercise is 50 to 80% of age appropriate max heart rate. And then I will, okay. And then I'll pass it to Jessica, maybe. Okay. Yeah.
Yeah, I mean, I think one thing that's really interesting when you look at the different studies that have been done, whether it's in Parkinson's related to physical movement or to the mood, or whether it's in patients who have Alzheimer's disease and they're looking at word recall, there are objective scales that we measure in our patients. And in these clinical trials, they look at the impact, and you look at a group of patients, what their scores are on the physical activities as well as in the cognitive domains. And then you put them on an exercise program and remeasure. And when you demonstrate that these things actually improve, there's studies that show that patients with Alzheimer's disease, you can increase their word recall by up to 30% just after 6 weeks of a defined exercise program. And it's pretty robust. And, we don't have a pill that does that.
No, but that's exactly what it is. So the prefrontal cortex that controls the cognitive functions like attention, the working memory, the executive function, we can improve that and work on that through blood flow to the brain. So we need the constant blood flow, which we will get by getting the higher heart rate and the higher intensity exercise. So it really helps to get that blood flow to the brain. The other thing that's really important is establishing a routine. So we don't want to just go and start going out and walking 5 miles tomorrow. Sarah will touch more on this, but we do want to get into a routine of when we're going to exercise, and it's really important for cognition, but also for consistency. So it takes 3 weeks to establish a routine of staying with a program, but it only takes 3 days. Kathy said maybe even 1 to get out of a routine. So it's so important to stay in that routine. An exercise routine, you've got to get up.
Gets a break.
Yeah, you've got to keep going. So you have to stick with it, because the second that you stop, it just kind of all slides back. So the important thing about it is trying to figure out the best time of day that you are going to exercise. So talking with Dr. Iyer about when your medication takes the full effect. So he'll talk a little bit about that. But so working your exercise routine around when you're going to do the exercises and take your medications. So
it relates to the medication timing. I mean, the mainstay of the medication, typically we're talking about the carbidopa, levodopa, the dopamine replacement in Parkinson's. And we really want the exercise times to be when your medicines are working, when the symptoms are under good control, when you're moving better, walking better, so you can actually exercise better. Some of you may have seen there's a levodopa inhaler called Inbrija. It's sort of almost like a on-demand rescue kind of treatment. It just kind of gives people sort of a quick on that lasts for about an hour, but sometimes people actually will use that before they exercise so they can actually exercise harder and better. And not suggesting that people over-medicate, but there are ways to strategically make sure that you get the maximum benefit from your exercise. Some people have issues with their blood pressure getting too low at different times, so we really have to figure out how do we fix that problem so they don't experience that during their exercise time. So. Well, I think that as we transition, really the question is, there's so many different ways to exercise that we need to be looking at, but how do we do it in the most effective way, in the ways that, we're not going to cause injuries, because, injuries happen.
Yes. So I was going to touch on, for sure, the orthostatic hypotension with the medication for safety considerations is definitely a concern. So we want to make sure, first of all, that everybody is well hydrated before they start exercising, during, and after. And electrolyte packs are great, because just the water, sometimes you're just going to see it all out. And so we actually need these little electrolyte packs to make sure that you are getting the benefits of that hydration for exercise. Another huge issue with Parkinson's is posture. The disease itself affects your basal ganglia, which is responsible for your postural muscle tone. It's also responsible for your balance and what's called your proprioception, of knowing where your body is in space. And when we go and all of a sudden try to do a high intensity exercise that your body has not done, and maybe you've been sitting and being really sedentary for a while, it can shock the system. And we end up actually with a lot of patients who are coming in with pain because they go and join a typical exercise class, and their bodies aren't ready for that. So being aware of where your posture, and that's something that physical therapy can help with, and doing some smaller, easier corrective exercises to then be able to tolerate the more higher intensity exercises can be really helpful. Going along with that, appropriate footwear is also very important, especially because of the posture. And the biggest issue that we see with Parkinson's for mobility-wise and fall risk is that shuffle step gait pattern. So we have issue picking up our feet. So whether that's an issue with hip flexor strength or the front of your shin strength or tightness in the calves is usually the biggest issue. And tightness in the calves comes from a lot of times what shoes you're wearing. So most shoes that are ever been made, especially if you're a woman and high heels, have a pitch. So the heel counter is taller than the front side of your foot. So even just that little bit, it's like you're walking on high heels, which puts our calves in a shortened position. And so if you have Parkinson's and you're already shuffling, that's going to further tip your pelvis forward and make you shuffle even more and make your head come forward. And it makes it very easy to come tumbling down. So there's a huge trend with these platform shoes, these Hokas. I'm gonna knock on them a little bit. I'm sorry, but not even just Hokas. Like even I was at the Nike store this weekend, and the new Pegasus. I think it's like literally you're walking on stilts, and most of our balance control centers and sensory receptors for balance are located in our feet and our ankles. And there are studies showing for athletes that people who have better ankle control showed better athletic performance and better balance in general. Yes. And when you wear very supportive shoes, such as Hokas, but there are many others, you lose that ability to control your own ankles and know where your body is in space through your feet. So it's kind of like trying to listen and wearing earmuffs. You are muffling those receptors. So I strongly suggest, I wouldn't suggest going straight into a barefoot style shoe is what I wear if you're used to wearing something overly supportive. So just as I wouldn't suggest going right into a very high intensity exercise program, we have to wean yourself out of a very supportive shoe into something slightly less supportive. But what I will strongly recommend is searching for what is called a zero drop shoe. So there's tons of different brands out there. But that means that the heel pitch is not, and the front side and the back side of the shoe are the same height, so that there's no pitch forward. The other thing that I would look for is something with a wide toe box so that your toes can really splay, because that's how we grab the floor for our balance. So there are lots of great brands out there. I know I really liked Ultra's make a wide toe box with a zero drop, and they also make more supportive ones if you are used to being in a more supportive shoe, that's a good transition into.
What brand was that again?
Ultra, ALTRA.
Anybody else that?
There are a lot of others that I can't think of offhand. I wrote a blog. I gave some examples. Like I got to put them.
So basically, if I can ask a question, basically, the brands that we watch on television that all the athletes wear are the ones you don't want us to wear.
Pretty much.
One quick way to test out the shoes when you go to try on different pairs, and I'll tell my patients, if you're able to, just put one hand on a counter or a shelf or something and see if you can balance yourself on one foot with that shoe on. because that'll give you a sense of your ankle control. If you can't balance yourself on one foot in general, don't do that. But, see if you can stand with your feet together as close as you can and see what that balance feels like. Because, I've tried on a few of these, running shoes as Sarah was talking about, and the ones that have the more and more cushion you get, it feels wonderful when you're jumping up and down, but your ankles, their balance, it's not great. So that's just a little trick you can try.
Yeah, I will link the blog on our website with this recording, the blog that Sarah wrote, which names more sneakers.
Yes. And there's also, in doing my research, I found there's a brand that specifically makes a Parkinson style shoe that's zero drop with a wide toe box, and it's more of a dress shoe style. So you don't always have to be in sneakers if you're not exercising. You can still be safe.
Tickets? That one?
No, I've never heard of it before. Yeah.
Well, I know, Melanie, we have a patient who's interested in sharing some experience with exercise. I can't see the guest list if she's joined.
Kitty.
Kitty, are you able to turn your microphone on? And it's nice to see you.
We can see you, but we can't hear you. If you'd like to share your story, just click on your microphone icon.
Can you unmute her from your
You
end?
can ask to unmute her.
Hear me now?
Yeah, perfect.
Perfect. How are you?
I'm good. Hey, everyone in the meeting. I'm Kitty Hartung, and I went to Dr. Iyer about a year ago and got a definitive answer that I do have Parkinson's. And I have been an exerciser for many years, but I have sort of slacked off here in the last, 4 or 5 years since I retired from teaching. The more time I had, it seemed like it'd be the opposite. But anyway, once I talked to Dr. Iyer and realized I do have it, and got through the idea that this is the worst thing that's ever happened, and nothing's ever going to be the same, I started really thinking about the exercises I was doing. And by the way, the shoes that I like are Mizuno. They've got a nice toe box. Mizuno, I think, makes a good shoe. But so I started going to the JCC. That was my first thought, or first plan. And I went over there and joined a dance class. And it's not really what it sounds like. It's more of a balance and agility, and with a little bit of dance and some weight work and mat work. So she's great. These ladies have been dancing together for 35 years, and it's not hard. And I was telling Melanie that someone introduced me to a much younger woman than I am, who was just diagnosed with Parkinson's. And of course, she's heartbroken. She's got 2 teenagers, and she didn't want to exercise. She didn't want to do anything. And so the person said, just try to go with Kitty for a couple of her classes and see. And so she's come with me to a cycle class, a dance class. We've talked about going to a rock steady boxing class, but she realized it's not that hard. What we're doing is not hard. It's just all about balancing and, working all of your muscles and making sure you're stretching well. And then I've told one of Dr. Iyer's assistants that I found this video. I've looked at most of the Parkinson's videos of things like what can I do, which ones do I like, and kind of culled through them. And I found one that I really, really like and have highly recommended. The young woman that has now started exercising with me says she just loves it. I'm trying to find the name of it really quickly. I got it from YouTube, and it's a Parkinson's driven exercise, and it's called, well, I don't see it, but it's called Body Balance, Brain, Agility, Flexibility. It's just done by the Parkinson's Association, and I do that every afternoon. And it was the first time I did it was the first time I felt like I had any real control over myself and what I was doing in this disease. And so I'll stop now, but that's what I've done. And I found that the exercise has made me feel so much better. and I find that my symptoms really calm down, and I really feel like I'm doing better than I was before I saw Dr. Iyer. So,
Kitty, if you find that web link, if you put it in the chat, that would be great.
yeah, I'm going to find it while you guys go on.
And also on our website,
Link for us, and then we'll get it.
we'll put it in the chat. And on our website as well, there's a link to a community calendar, and there we have links to some online yoga classes and other kinds of exercise classes for Parkinson's patients.
Yep.
And links to the Parkinson's Association's site, which has many, many more.
Well, Kitty, thank you for sharing that. And I think, often I feel like a broken record when I'm just talking about exercise with my patients, and then most of them listen and engage in it. But sometimes hearing from one of their peers, I think means a little bit more, and especially when you talk about how it impacts their symptoms, not just the physical symptoms, but even the non-motor symptoms. Quality of life. You look at your mood, you look at sleep, all those different things. So it's great to hear from you. Thank you for sharing that. One area that people get very interested in are technology. Where's the intersection of technology with medicine and with different therapies? People with whether it's cognitive impairment or Parkinson's, there are so many gadgets and apps and tricks and tools and things that we've all come across that are worth talking about. And I think, Jessica, you've come across an interesting one, and we were sharing the experience with one of our patients. You were there. If you want to share the app.
I was just with a patient of Dr. Iyer's, working on speech therapy. And she said, I was just at Dr. Iyer's and he prescribed this app for me, and it's called Parky. And so next time you come see him, come talk to him about it. He's got to give you a prescription, but it will, it goes on and it tracks. You have to have an Apple Watch and an Apple phone, but it will go on and track what kind of different movements you're having. It'll track, you can add your medication. It really helps develop a routine. It'll give you, I'm going to say it wrong, haptic. I always say habit, but it's a haptic. So it's like a vibration on your wrist to tell you if you're frozen in gait, different symptoms. So it starts to learn you, and then it will give you cues on how to get through some of the symptoms that you're having. So it was pretty interesting. And then you can talk more about it, but it was neat for me that we had just talked about it last week, and then I go to her house today and we're like, oh, here we go.
Yeah, so this is the first experience we're going to have with it. I have a few other patients who are in the midst of getting it set up, but it helps, number one, track. It will track which movements are tremor, Parkinson's symptom, shaky hand, but also it'll track another movement that we call dyskinesia. That's usually a side effect from the medication, but it tracks it in time. And plots it on an axis against when you took your levodopa. And so in a sense, it helps us understand, okay, if your tremor spikes 3 hours after you took your medication, and that's an hour before your next dose is due, well, that's a no-brainer. We need to take it sooner. It really is going to help track that. But for people that have that really disabling freezing of gait, where their foot sticks to the ground, they're trying to get up and walk, but their foot just won't go, and they can't pick it up. The vibration that will come from the watch somehow unlocks it, or it's proposed to unlock it. So we're gonna find out. So more to come. But thanks for being there to help set it up, because I'm still new with this too. Well, we've all come across different tricks and different hacks and different things that you learn from your patients or you've taught to your patients. Are there other things that you guys or your colleagues have kind of shared or wanted to share?
Yeah, so one thing I know we were talking about going to rock steady boxing, things like that, starting an exercise program. A lot of times we want to come see one of our physical therapists first to they can go with you to the rock steady boxing to see if it's appropriate for you, maybe make some adjustments. So sometimes we want to make sure that the therapist has seen you because we don't want to say, hey, this hack works for every single person, because some people it may work for, or some of the exercises it may not work for. So we want to see each individual person first to make sure that it's a safe exercise program for them.
Yeah, especially freezing of gait is a symptom. We like to work with people first and try to help them with their compensatory strategies for the freezing of gait and kind of get it under control. We have a lot of tips and tricks for freezing of gait. Of course, the best thing is stopping when you're frozen, which I think is the hardest thing for anybody to do, is to recognize the freeze and stop. So there's a lot of practice that comes along with that. And then each person kind of has their own little trick to get out of a freeze. It's actually very interesting to see like what works for each individual person. But I think, tricks for exercise are that you have to do it. You have to just do it, and start small. Don't go crazy. Like Sarah said, if you don't know how to exercise, find somebody who can help you. Of course, we're physical therapists. We can help people exercise. We can get people a high intensity exercise. The Apple Watches are really great because they track your heart rate. And that's how you figure out if you're in high intensity exercise. So a lot of times if you're working with us too, we're like teaching you how to use the apps that you have. The health app that's on Apple is really great. And then we can kind of look back and make sure if you told us you exercise, it will actually hold you accountable and say, wow, I don't see that your heart rate went up. I did that with someone today, and then they were like, oh, wait, I don't think I wore my watch. I was like, okay. So little tricks like that. When you have that, you can share your activity too. So you can share it with a loved one. You can share it with us. So when you do an exercise, we can actually get an alert. I mean, it's really, really kind of fun stuff.
It's very motivational.
Yeah, Apple is so great. I'm sure the other ones are great too. It's just, I know Apple. So if someone has a non-Apple device, we'll figure it out together. But
there's just, every day, there's new devices, new apps, new things. I mean, it's so hard to keep up with what's out there. And so again, I mean, a lot of these things, I learn about from my patients. Hey, do you mind checking this out? Because I saw this and I don't know if there's any, if this is legitimate or not. So I'm happy to look at things if people come across interesting things. We're all happy to look at those. As it relates to, cognitive function, I remember it was maybe 6 months ago or so, you were showing us a product or a demo back in the gym. It was sort of, I don't want to use the word games, but it was a lot of cognitive activities. If you want to kind of share what that is and kind of how that can help.
Yeah, it's a program we have here at in our gym. We've got a gym here on site at Mid-Brain Movement, and it's called It's Never Too Late. And there's a lot of different cognitive exercises on it that we'll do that work on attention, that work on short-term recall, that work on kind of divided task. I also have an app that I take with me on an iPad to people's homes that we do exercises with as well to keep the brain strong and continue to work on cognitive function.
Are these apps that you recommend to patients or their family members to download onto their devices, and they can be doing it themselves as well?
Yes, so we can, I've got the kind of the instructor one, and then I can assign homework. And you get like a 2-week free trial. It's not one that we sponsor or anything, but they can get a free trial for 2 weeks to see if it's something that they want to continue afterwards. So I do have, and again, we can monitor that. So I can say, oh, I saw that you were doing your cognitive exercises this day, and I've had really good success with it.
we have a med bridge too that we use with our patients, where we can assign them their exercises and then they have to check in. And then we can see when they've done them. So I think the biggest thing with exercise, a lot of times accountability is a necessity. You know, if you have to report to somebody, you're more likely to do it.
Well, you know, again, when you step back and you look at conditions like Parkinson's, like Alzheimer's, you know, these conditions that we treat here, you know, we haven't discovered a pill yet that really slows the progression. You know, we can treat symptoms, you know, reasonably well, but you know, how do we slow progression? It's all of these things that we're talking about here. And so when you think about setting your watch for a time to take your pill, you know, setting your watch for a time to do your exercise, I mean, it's the most important part of your treatment. And that's why we're not only dedicating this session to it, but multiple other opportunities as we move on. People will ask all the time, well, there's a class across town called Rock Steady Boxing. Should I go to that? I'm already doing these kinds of exercises 5 days a week for an hour. Am I missing something by not going to that class? And what I would tell you is that all movement counts. We just want you moving. I think Rock Steady Boxing is a great class. There are a lot of other great classes too, and I think you really have to find the one that suits you and what your interests are, what your needs are. Obviously, there's the movement aspects of the exercise, but there's also the social aspects that we talk so much about, the fellowship that comes out of it. You're exercising for the same reason, with purpose, with other people that are there for the same reason, and the socialization is what really helps stimulate the cognitive connections that we all need. And I think that's why we just encourage people to engage and join. And, whether it is the formal Rock Steady Boxing class or some other class, it's important. People have submitted a few questions. One was just, what is Rock Steady? And since we've all mentioned the term, so it is a sort of it's a class that was designed by a boxer in Indianapolis who developed Parkinson's disease. And he noticed when he trained in certain ways and doing certain types of exercises, his tremors would go away and would get better for a period of time. And his hands were rock steady when that happened. So that's where it came from. And he sort of, got the trademark and whatnot. So if you want to deliver a class, you have to go and get trained and certified. And so there are a number of locations in town where they offer that exercise class, and it's wonderful. They work on balance, they work on strength, they work on repetitive motion, they work on hand-eye coordination, they work on voice, they work on cognitive function. It's the full Monty, but it's also the fellowship that everyone tells me is really the secret sauce that comes out of it. But just because the sign doesn't say Rock Steady Boxing, it doesn't mean it's not worth doing it. I mean, there's so many other offerings around town at the various YMCAs and at other recreation centers. There's even pickleball opportunities for people. Ping pong, I mean, you name it. So we just want you to keep moving, and if you're not moving, then get moving.
Rock Steady does count for the high intensity exercise. So for those who are doing it, it counts for high intensity exercise. The whole point of it is to get to that high intensity. And they do. I've been to the one at the JCC and they push them pretty hard. I haven't been to the one that's on Wendover, but they definitely give you a good workout.
And when you go to these classes, typically what they do is they'll ask you to come in for a session where they can do an evaluation. They want people to be successful. They don't want to put someone in too advanced of a class too quickly before their balance catches up. They don't want to put someone in the beginner's class if they're a fit athlete or much better than that. So they want to match you up to the right level to start, so we can then chart the progression.
But really, there are studies showing the benefits of ping pong for Parkinson's. That's a true thing.
Mm-hmm.
Pickleball will come out soon. I know it.
When you look
might have to do our own study.
There are a few studies looking at ping pong for Parkinson's as well as ping pong for Alzheimer's, and in Parkinson's patients, they were working on a couple of things. One was balance. You're constantly having to move back and forth. When you look at repetitive movement, and they're looking at the rigidity in the limb and how you can improve that with that type of a function. And then in the Alzheimer's patients, they've studied word recall before and after ping pong sessions, and it's interesting. You can see how you can stimulate memories. You can stimulate conversations as you get people into that motion.
Yeah, the crossing over. So you're crossing over both sides of the brain, and it's helping with blood flow, and it's helping with just making your body do both things at one time.
Anything with reciprocal movement patterns, so alternating right, left, gets the brain working both directions, which is why boxing has gotten such a big name.
Somebody asked, how about pickleball?
Yes, same
Yeah.
motions.
I think it falls into the same category as,
And much more higher intensity,
High intensity,
for
so.
sure.
and it's very popular right now.
We knew it would come up.
Yeah.
When you talk about doing it safely, you
I
gotta
was
be
just
careful.
about to say
Yeah,
the safety
I've
aspect
had a
of
lot
it.
of injuries from pickleball.
I was like, I'm happy to go with anybody and play pickleball with them. It's fun. I know, and like everywhere, they're just courts are popping up everywhere. It's very, very popular. So it is very good for you. You gotta do it at least 30 minutes though. That's the key.
And you definitely need good ankle mobility for pickleball. I've had a lot of torn Achilles from that sport.
And hand coordination. Oh, it's great.
One area is that, Kitty had mentioned that there was an online resource for exercise. Are there specific websites that you might direct your patients to? I know during the pandemic when none of us could go to an exercise class, a lot of things popped up. And I know as it relates to my Parkinson's patients, there's an organization called Power for Parkinson's, and they've sort of created an online library of a lot of different exercise classes that you can watch and follow along with, even some Zoom classes that are kind of live that you can do. Some Tai Chi related, some boxing related, some yoga related, a lot of different things. But are there certain other sites or certain areas that you guys recommend?
So, one that we try to get people involved in is, so Power Moves, PWR exclamation point moves, is a association that we get some certifications for treatment of Parkinson's, but they also do online virtual classes. And this is all research-based exercises for Parkinson's. So we usually recommend that because we know that it's backed by research, that this is going to help.
Did I spell that wrong? POWR, did you say?
PWR,
PWR, thank you.
exclamation point moves. What is it? Parkinson's Wellness stands for something. Very important. Well, we put if you put the PWR exclamation point moves, and they, you can go on YouTube and find it too, but they are, patented exercises. So you do kind of have to get into their program, and we follow a lot of other therapy companies that do online classes as well. So we love the online classes, of course, especially post-COVID. People are more nervous about going to classes, gotten in the habit of exercising at home, but we do recommend in-person classes as much as possible. And then on the other days, do the online stuff. But you can just go on YouTube and you can basically say exercises for Parkinson's, and there'll be 100 videos that come up because everybody's doing a video for it. But for us, we want the Power Moves. Big for Life is another program. That's the LSVT Big program. They also do the LSVT Loud. Speak Out is another speech one that does online stuff. So anything that is geared around those programs, you can know that they are research-based exercise program that are specific for people who have Parkinson's. So we usually recommend those. And then Back to Independence is I'll give them a shout out. I love Darcy, who runs that program. They are an in-person wellness clinic in Charlotte, and they do Power Moves class. So we love Darcy.
Before we go too far, somebody asked a few minutes ago, what was the name of the Parky app? And did I spell it
It's
correctly?
PARKY.
I did spell it wrong. Okay.
Yeah.
PARKY.
Yeah, if you just go into Google and type in Parky app, the website pops up and you can read all about it. It is on the App Store where you can download it. But yes, it's interesting to read about. There's an area for patients to understand what the product is and what to expect from it. There's an area for the providers where you create a provider portal, so that I now have that. So I can go in it and I can put the prescriptions in the portal. And then I guess when you go and try to download it, it will release.
Yeah, it sounds like a text.
It releases to you, and then boom. So it's interesting if anyone wants it. and you're one of my patients, let us know.
Should we go on to questions?
Yeah. What do we have in the chat box?
Somebody just shared that Back to Independence actually has a free class Wednesdays at noon.
Okay.
Thank you. If anyone else has any questions, feel free to turn your microphone on and speak your question, or you can put it in the chat box.
Dr. Iyer, Steve Sheehan. I have a question about swimming. I know we've talked about it generally, but do they have any programs that fully developed for swimming like the other programs we do, where we have specific exercises for?
I haven't seen sort of a coined or patented sort of exercise program around swimming specifically for, any of these conditions. I do think that swimming and water therapy is a wonderful way to do it. I think there are certain places that have aquatic centers and even instructors that do a lot of work in the pools. I know at the JCC they have a very nice pool that you can get into and do a lot of walking. If balance is an issue, you can do a lot of resistance training in the water. Other places around town, I don't know all the different offerings, but I think water therapy is wonderful. I mean, I'm sure you guys have a lot of experience in working with certain patients and what's good for them and where are some places they might be able to seek it out.
Yeah, so the water aerobics type of activities definitely improve cognition. It's a form of aerobic exercise. It's a great way to get into the kind of moderate, high level intensity. Hasn't necessarily been any research related to Parkinson's. Most of us think on the ground training for Parkinson's is better because gait abnormalities are one of the primary symptoms, but we don't discourage it. We just say it's an addition to everything else that we're doing. It's something to give you a little, different style of exercise. So it's not the same repetitive thing anymore or every day. But there hasn't necessarily been any research showing any correlation with Parkinson's, but highly correlated with improving cognitive function.
And it might be.
I didn't catch the last part of your sentence. You said something was not done well. Or
There aren't studies for Parkinson's specifically, but improving cognition, it definitely does, she said.
Okay.
And I just wanted to add that for those who maybe can't handle the 30 to 60 minutes of aerobic walking activity, that's strongly recommended for Parkinson's on land because of pain or arthritis and things in that nature, that swimming or pool water walking might be a good alternative so that you can still get that time on the muscles without causing so much stress to the joints.
Okay.
Yeah, very true. So people with Parkinson's are, they also have, arthritic problems, bad knees, stuff like that, which is why it's so important to work with a physical therapist initially so that we can safely get people into an exercise program. I actually had a gentleman with significant knee problems. He started in the pool. Once he got a lot stronger, he was able to get out of the pool and start doing over the ground activity. So it's important to work with somebody very knowledgeable to help you if you have a lot of osteoarthritis in your lower extremities or back pain too. That's a big issue we run into in terms of barrier strength exercise is what I would call it.
One area we haven't touched on, and if we have a minute, I'd love for Sarah to educate us about some of the myofascial work that you do, as you talk about, the soreness that people get from working out, the stiffness, the rigidity. But I mean, you've done some remarkable things with a few of my patients that I was really amazed.
Thank you. So with anybody, I want to say, could benefit from myofascial work, but especially in a Parkinson's population, that rigidity, the stiffness of the joints, because you're not using that postural muscle tone, you're using your larger muscle groups, which get fatigued and they get really tight and stiff and sore. And that makes you not want to exercise, and it makes you have pain. It makes you not be able to access certain movements that maybe an exercise is telling you to do. And with the hands-on treatment that I have been doing, which I'm going to my next training tomorrow, I'm very excited. It's all neck and upper back, which I know we get a lot of that for you Parkinson's patients as well. Anyway, so I've been able to mobilize the tissues, mobilize the joints to help relieve pain and also in time even change the structure, which can happen over time because it takes a long time to get that way. It takes a long time to unget that way. But yeah, so I can change how the body moves, how the tissues move, especially so that you can feel a lot freer in your body and be able to do the exercises better. And initially, like right after I do it, you might feel more off balance because you are so used to moving in your certain stuck way that your muscles have only allowed you to move. But then the next day, all of a sudden you have this new range of motion available, and then you can perform a lot better. It's made a lot of difference in gait and walking, work on the ankles, and yeah. Oh, so I also wanted to plug my website in here. So I have a website called mywinpt.com that I teach a very physical therapy specific yoga method. And so on there, I record all of my classes, and I have 2 on there that are specific for Parkinson's. One is the shorter 30-minute version. It's called Prevent Parkinson's with Power. And the second is a full longer hour version that you can work your way up to. There's also a whole library of resistance bands exercises for various ailments, knee pain, hip pain, back pain, and a ton of different yoga classes too. So you want to check it out?
Well, thank you guys to our all-star cast for all the great work that you do, and thank you, Katie, for joining and sharing your stories, your experiences, and appreciate everyone joining tonight. And look forward to next month.
Yes.